Hi guys, Dr. Bub here with Pure Family Medicine, wanting to give you a quick message that's hopefully both realistic and reassuring about coronavirus in the Denver area. So as most of you know, there's now been 2 confirmed cases of coronavirus in the Colorado area. One of them was actually not too far from our practice here. So even though both of those people likely were exposed out of state and brought it into Colorado, most of us in the medical community feel that it has actually been here and has been circulating for the past few weeks. But unfortunately, we haven't had tests for it, and so you can't diagnose something if you can't test for it. Now, I say this not to scare you, but more so to reassure you that, this day when they confirm the cases is no different than any day over the past month. This has been here, it's been circulating, and now we need to figure out what to do with it. So it has the potential to cause very serious complications. In fact, most of the infectious disease doctors in the area are predicting that by the time this is all said and done, most people will know at least one person in their extended circle who dies from this, and that's pretty scary. However, the overwhelming majority of people are healthy, and if they're healthy, chances are they are going to have cold symptoms, flu-like symptoms, and may never know that they have coronavirus. And so that's another reason why this is so scary, is because people are going about their daily lives and most likely spreading it. So we need to take extra precautions to protect those who are at the highest risk. In our practice, we're taking some precautions to protect ourselves and our patients, because we know that the highest spread of this virus is actually in doctors' offices and in hospital systems. So we're actually doing televisits or FaceTime phone calls with all of our patients who have respiratory symptoms or fevers, and trying to manage what we can out of the office. That does 2 things. It ensures that they're not going to catch something sitting in our waiting room, and reassures our other patients that they are not going to get coronavirus coming into the doctor's office. Those who need to be seen, we're bringing in a back door into a specific room so that they are quarantined from other people. Now, this is something that we offer free of charge for our patients, and we are accepting new patients if you need something like that. Now, what do we do about coronavirus? This goes without saying, but practicing really good hygiene. So now is the most important time to make sure you are washing your hands really well, not touching your face, your eyes, nose, mouth. And if you do have a cold or a runny nose, please take it seriously. It's not the time to be going to work. It's the time to stay home and quarantine yourself so that you're not spreading it to the people who are high risk. Who are those high risk people? Anyone with chronic diseases. So lung diseases, heart disease, diabetes, or any chronic medical condition are at the most risk for having serious complications, as well as people who fall into the older age category. So if you fall into one of those categories, make sure you're working with your doctor to make sure that your chronic diseases are controlled, so that you are as healthy as possible if you do get this. And then lastly, try not to stress about it. Even though it's a big deal, the news is very sensational, and stressing about it is only going to decrease your immunity. So I recommend meditation. I recommend, if you have nervous energy around this, putting it into something positive, like eating healthy, exercising, trying to be as healthy as possible. And lastly, now is the time to make sure that you have a doctor. So you do not want to be sitting in an urgent care, waiting to be seen, and being exposed to something else. You don't want to be in an ER unless you absolutely need to be in an ER, because again, this disease is spreading through those systems rapidly. So if you don't have an established relationship with a doctor, now's the time to create that. and make sure you have someone you trust that you can call if you do get sick. Otherwise, stay healthy, and let me know if you need anything.